update you on a couple of exposure risk sites that we have in Murrumbidgee Local Health District, which occurred over the weekend, or we were made aware of over the weekend. So in Henty and Coolac, there was a essential worker from Victoria who travelled to those regions. So at Henty, on Thursday the 26th of August, between 4:45 and 10:05, the Shell petrol station, and at Coolac at the mobile highway service station on Tuesday the 31st of August at 4:30 to 5 o'clock. There was a risk venues there, so people who were there are classed as casual contacts at that time. If they could isolate at home and get tested until they are negative, and then they're allowed free to go. And then yesterday we've become aware of exposure sites at our Harden area from also an essential worker who was in the region over a few days. And so those areas that we've been able to identify to date is the IGA at Harden on the 3rd of September at 4:45 to 5:15 p.m. The Light Horse Hotel at Harden between the 3rd and the 4th of September. And the Southwest Fuel stop at Harden on the 4th at 6:10 in the morning to 6:45 a.m. So those venues are now, again, if you're at those venues, you'll be classed at that time, you'll be classed as a casual contact, and if you could get tested and isolate till your results come back, and hopefully that'll be negative and it'll be sweet. So I think, again, that's another timely reminder that there are COVID cases driving through our region, and we do need to be very vigilant. If anyone has any symptoms at all who are in those towns or any other town, please make sure you get tested, and that way you'll know for certain that you're not positive, or if you are, we can act on that accordingly in a timely way. It's really important too, if people are not vaccinated yet, to get vaccinated. So make your appointment with your GP or the health service online process to book in and get vaccinated. The sooner we all get vaccinated, the sooner we can go start living our lives back a bit more normal, how we used to live them. So please, encourage you to get vaccinated.
That case that has travelled through our region, do you know which part of Victoria they had come from?
No, I'm not aware of that.
Do you know what essential work?
Look, it has the different essential workers for different reasons. Some are truck drivers, some are railway workers, there's a whole range of essential workers that are in our community. The good thing about essential workers are they regularly test, so they have frequent testing. And so that should they turn positive, they get picked up pretty quick. So that's a real positive about the essential worker.
And this person seems to have done all the right things in, testing and isolating and reporting where they've been.
Yes. So because of the complexity of the number of venues and so forth, with that case, we're still working through some of the risk sites. There's some also risk sites in Southern New South Wales Local Health District as well. So we're just working through those.
Are you expecting any more exposure sites to pop up as a result?
Look, not in Murrumbidgee that I'm aware of at this point.
The Henty case was quite a small period of exposure. Would you be concerned if someone was there like within the half hour or the 10 minutes before or after or anything like that?
No, look, we usually take a pretty broad brush with our timeframes as well, so that we try and capture anyone who may have checked in a little bit after they arrive, so to speak. So we do try and do a few minutes either side, but it was a brief exposure. And again, I will say, if you're there at that time and you have symptoms, get tested. If you're there outside those times and you have symptoms, please get tested.
And the Henty business, what sort of protocols did it have in place?
Look, we have spoken to the businesses. We make sure that their staff are not at risk, or if they were, then we ask them to isolate and test as well, similar to any casual person who might have been in the shop. And depending on the risk exposures, they will clean the premises to just make sure there's no ongoing risk there.
How many tests were conducted over the weekend?
Sorry, I didn't hear that.
How many tests were conducted over the weekend?
Look, in the last week, I can give you the last week's testing data. It was 2,193 tests done in Murrumbidgee. And certainly we've also done a lot of vaccinations. So the Murrumbidgee vaccination team has vaccinated over 36,000 people since the start, and last week we did just over 2,300. But that's just the Murrumbidgee services. The GPs are also vaccinating as well on top of that.
We keep getting close calls. How relieved are health authorities?
Say that again, sorry?
We keep getting close calls. How relieved are health authorities?
Well, yes, of course. Close calls for the public health unit often involve a lot of work anyway to eliminate and rule out those. But look, I'm just keeping my fingers crossed that the district will maintain zero COVID cases, but I'm sure it will come.
And when's the next sewage testing going to happen?
Yeah, look, sewage testing is sampling is collected in our region twice weekly in a lot of venues now. So the yesterday's testing had no sewage detections in any of the sites that we had sampling done late last week. It usually takes about 3 days for the results to come back after a sample. So we're having lots of testing in lots of towns around the area now, and fingers crossed that will continue to stay negative.
Can you tell us about the 2 COVID cases under investigation in Balranald? Sorry, don't know how to say that town.
Balranald's actually in Western, and that's not our local health district, so I can't speak about that.
You did say that you're expecting it obviously to eventually come to the region. I guess a bit of word of reassurance for the community, and also what do we do when that time does come, if it does?
Look, the public health unit will advise the community when we do have cases like we do now, where we're tasking people to isolate and get tested. Our health facilities are prepared so that should people need healthcare, and we also actually have for people who are positive COVID, we have a home monitoring set up so that the health system can monitor those people who are well enough to be in their homes, just to make sure that they don't get deteriorate and need hospitalisation. And so we do have good systems set up for people should they become positive in our region.
And just on the Wodonga positive case, I'm assuming you're working closely with the Albury Wodonga Health. There's no exposure sites listed now for the region, but I guess how does that impact the local health district and what's being done?
Yeah, look, we were aware of that case very early in the piece, and we have worked with Albury Wodonga Health Public Health Unit on that. And from our understanding of interviews with that gentleman, there is no exposures in Murrumbidgee that are considered a risk exposure.
The current exposure sites, what are they saying about QR code compliance?
Look, I have heard no comments particularly about that. There are people who QR code and check in, and we're slowly getting through some of those sites. We have the code sent to us, and we work through those. So I have no particular comment about them. It looks like people are checking in.
Yeah.
Is it? Thanks very much, everyone.
Thank you.
Okay, thank you.